1. Which principle of adult learning emphasizes that learners bring prior experience into the educational setting? A. Constructivism. E. Andragogy. C. Behaviorism. D. Classical conditioning. 2. When evaluating hearing aid fitting outcomes, which tool best measures patient-reported benefit? A. Audiogram. B. Client-oriented scale of improvement, COSI. C. Tympanogram. D. Pure tone average. 3. In curriculum development for hearing healthcare professionals, which element ensures alignment between objectives and assessment? A. Bloom's taxonomy. B. Program evaluation. C. Formative feedback. D. Regulatory compliance. 4. Which communication approach is most effective when counseling an adult client resistant to hearing aid use? A. Directive. B. Motivational interviewing. C. Persuasive repetition. D. Didactic lecture. 5. What is the main regulatory purpose of HIPAA in hearing healthcare practice? A. Preventing billing fraud. B. Protecting patient health information. C. Ensuring product recalls. D. Standardizing audiograms. 6. A simulation exercise in IHS training is best evaluated using which method? A. Multiple choice test. B. Performance checklist. C. Written assignment. D. Essay reflection. 7. Which mentoring strategy fosters independence in novice hearing aid specialists? A. Giving prescriptive answers. B. Encouraging self-directed problem solving. C. Requiring shadowing indefinitely. D. Minimizing feedback. 8. What is the primary purpose of formative assessment in adult learning? A. Assigning grades. B. Improving learning during instruction. C. Meeting accreditation standards. D. Replacing summative evaluations. 9. During communication with older adults, which technique is most effective? A. Speaking louder. B. Using jargon. C. Slowing speech and using clear enunciation. D. Repeating the same phrase quickly. 10. Which instructional strategy best promotes retention in adults learning new audiology regulations? A. Memorization drills. B. Role-play case studies. C. Silent reading. D. Copying definitions. 11. Which federal regulation requires labeling and performance standards for hearing aids? A. FDA regulations. B. HIPAA. C. OSHA standards. D. FCC rules. 12. In competency-based education, the focus is primarily on A. Time spent in training. B. Knowledge memorization. C. Demonstrated ability to perform tasks. D. Number of supervised hours. 13. Which adult learning principle emphasizes immediate relevance to learners' job roles? A. Orientation to learning. B. Abstract reasoning. C. Operant conditioning. D. Cognitive dissonance. 14. Which communication method helps reduce misunderstanding with clients who have limited health literacy? A. Technical explanations. E. Teachback method. C. Rapid verbal instructions. D. Written policies only. 15. Which evaluation type measures long-term retention of hearing aid programming skills? A summative exam. B. Post-training survey. C. Delayed assessment. D. Peer observation. 16. A structured mentoring program should begin with A. Assigning independent projects. B. Clarifying goals and expectations. C. Limiting feedback. D. Reducing formal communication. 17. Which is an essential step in curriculum design for hearing aid specialist training? A. Random topic selection. B. Needs assessment. C. Peer grading. D. Course catalog review. 18. What is the best practice for documenting informed consent? A. Verbal agreement only. B. Signed written form. C. Peer witness without form. D. Client nodding yes. 19. In evaluating teaching effectiveness, which method best captures learner satisfaction? A. Pretest scores. B. End of course survey. C. Simulation exam. D. Observation checklist. 20. Which mentoring style is most effective for adult professionals? A. Authoritarian. B. Collaborative. C. Passive. D. Indifferent. 21. Which assessment tool evaluates real-world application of learning in hearing healthcare? A. Multiple choice test. B. Case-based scenario. C. Word matching. D. Crossword puzzle. 22. Which ethical principle guides confidentiality in client communication? A. Beneficence. B. Autonomy. C. Fidelity. D. Justice. 23. Which element of evaluation focuses on determining whether learning objectives were achieved? A. Formative assessment. B. Outcome assessment. C. Diagnostic testing. D. Clinical observation. 24. Which strategy supports adult learners' self-motivation in hearing healthcare courses? A. Allowing input into learning activities. B. Standardized memorization tests. C. Strict lecture-only format. D. Passive video watching. 25. Which compliance measure protects consumers from misleading hearing aid claims? A. HIPAA. B. FDA labeling rules. C. ADA. D. OSHA. 26. Which instructional design model emphasizes analysis, design, development, implementation, and evaluation? A. ADDIE model. B. Kolb's cycle. C. Maslow's hierarchy. D. Cognitive apprenticeship. 27. When mentoring a new hearing aid specialist, what is the mentor's primary role? A. Provide unlimited answers. B. Support skill development. C. Focus only on policy review. D. Eliminate all errors. 28. Which communication skill is crucial for client-centered counseling? A. Active listening. B. Monologue delivery. C. Complex terminology use. D. Silent observation. 29. Which type of assessment provides immediate feedback to improve instruction? A. Summative. B. Formative. C. Standardized. D. Diagnostic. 30. In adult education, which principle relates to applying learning to real-life challenges? A. Experiential learning. B. Abstract thinking. C. Operant conditioning. D. Latent learning. Which law ensures accessibility for individuals with hearing loss in public spaces? A. OSHA. B. ADA. C. HIPAA. D. FDA Act. 32. A reflective journal is most effective in evaluating A. Knowledge memorization. B. Self-awareness and growth. C. Technical skill accuracy. D. Test-taking ability. 33. Which mentoring action undermines professional growth? A. Giving constructive feedback. E. Setting collaborative goals. C. Solving all problems for the mentee. D. Encouraging independence. 34. Which evaluation approach focuses on measuring skill demonstration? A. Written test. B. Practical exam. C. Survey. D. Self-reflection. 35. Which adult learning strategy promotes problem-solving skills? A. Case study discussions. B. Flashcard drills. C. Copying lecture notes. D. Memorizing standards. 36. Which communication practice builds trust in hearing aid counseling sessions? A. Maintaining transparency. B. Avoiding difficult questions. C. Overusing technical language. D. Ignoring patient concerns. 37. What is the main purpose of accreditation in hearing healthcare programs? A. Increase enrollment. B. Ensure quality and compliance. C. Reduce competition. D. Promote marketing. 38. Which adult learning factor is most influenced by self-concept? A. Memorization. B. Dependence. C. Autonomy. D. Passive reception. 39. Which type of regulatory compliance requires proper calibration of audiometric equipment? A. HIPAA. B. OSHA. C. ANSI standards. D. ADA.